Okay, so this is the Collateral X tape. It's for MCL and LCL sprains, and it provides mild to moderate support from valgus and varus stresses. So you're gonna have one anchor strip up at the mid thigh, and then you want to put another anchor strip below the patella on the calf. And then to create your X's, you want to do one from the side down at the calf above the patella, and then do the other one on the opposite side, again starting from bottom of the calf and go over the patella. And then for your next part of your X, you're going to go below the patella. So start down here, go below the patella and come up. And then for the other X, do the same but on the other side. Go up to the side below the patella. And then you want to have your straight strips on each side. So start at the mid-calf anchor strip and then pull it straight up to the thigh strip, and then do that on the opposite side and have another one at that bottom strip and pull it up. And then you want to have your anchor strips to secure all your tape. So have one there. And then when doing this in clinicals, you would repeat the X's in a straight tape again to provide additional support. And then you have your anchors at the top, and again your anchors at the bottom. This is the McConnell taping, and it is for patellofemoral pain and also helps with malalignment. So you're going to want to put a strip of coverall over their patella, and then get the Leukotape or McConnell tape, and you want to start laterally and put it on the coverall, pull it medially until the patella is in the normal position, and then tear the tape. And then in order to make sure the patella is secure in place, you want to get 3 strips. So you can put one below, overlapping halfway of the first tape that you made, and then again just pull the tape so that the patella is in the normal position, and then get one above the original tape, also overlapping it. So for the hyperextension tape, we're going to start with anchors at the upper mid-thigh. And then get another one below the patella. Once you have your anchor strips, you want to take an elasticon strip and start it at the strap below the patella and then pull up in order to get security. And then you can trim the extra part of the tape off that you don't need. And then you want to get 2 diagonal strips and put one going in each direction so that you have prevention from hyperextension in all directions. So get one curves around the leg here, and then start the other one and have it curve around the leg in the opposite direction. And then these will help prevent hyperextension. And then to secure them, you just want to put tape over the previous anchors that you have. Okay, so this is the patellar tendon strap. It's to help relieve pain with patellar tendonitis. And you want to put your strap in between the patellar tubercle and the inferior pole, and you want 2 straps, but you don't want to do them continuously across the knee. So you kind of just do them half and half and then tear it and then go around again. And this is just to help alleviate some of the pain associated with patellar tendonitis. So this is the knee compression wrap, and it's to help with mild to moderate swelling and effusion of the knee. So you want to start below the patella on the tibia, and you're going to wrap it up the leg. And this is just going to help push the swelling out of the area, which is why you want to start down at the bottom of the leg and work your way up the thigh. And then you want it to be tight enough that it's applying compression, but not so tight that it's cutting off circulation. And then in order to secure it, you just wrap some tape around the top of it. And this will help your patient get rid of some of their swelling. So this is a hip pointer pad and wrap, and we're going to use this to help apply cushion to a hip pointer contusion, and the padding will help disperse the force in case they get hit again and protect the contusion from getting worse, and also help the patient not hurt as much if they get hit again. So we just wrap our ACE wrap around the padding, and then you're going to take a roll of Power Flex and secure the ACE wrap on. Can you hold that for me? And then just tear it. And then this would go under all of their clothing and padding. This is a thigh wrap, and it's for mild to moderate swelling of the thigh, and it's for mild sprains. So you want to start your wrap above the patella, and you just want to wrap it upward to push any of the swelling towards the lymph nodes. And you want it to be tight enough that it's applying some compression and pressure to help get the swelling out, but not so tight that it's cutting off any type of circulation. And then you also want to wrap some stretchy tape around it, just so that it'll stay on there even during their activity. So this is the adductor wrap, and you want to note that you want the patient's foot pointed inward, and you're going to start at the mid-thigh, and this is to provide mild to moderate compression for an adductor strain. So you want to start the wrap with it going horizontally across the thigh, and then have it go diagonally up through their ASIS, and then around the back, down through the leg again, and then pass up around the hip again, and then around back, and then you want to secure the wrap to make sure that it stays on your patient during their physical activity.